Cramps. Cramps are painful muscle spasms. When pathologic, they may represent abnormalities of muscle, nerve, or CNS. Although the following disorders do not have true cramps, patients with myotonia, neuromyotonia, tetany, tetanus, and stiff man syndrome often complain of cramps. Therefore, they are included in the differential diagnosis. Myopathic disorders, the painful muscle spasms associated with glycogenosis, most commonly phosphorylase and phosphofructokinase deficiency, disorders of lipid metabolism and carnitine palmitoyltransferase, CPT, deficiency, are designated contractures, and there is severe, intermittent, sharp muscle pain with palpable shortening and hardening of the affected muscles. Contractures may be precipitated by exercise. They are associated with increased weakness and are unaffected by curare or nerve block. The EMG is electrically silent during contractures. Treatment includes a high carbohydrate diet for phosphorylase deficiency and a high carbohydrate, low-fat diet for CPT deficiency. The cramps associated with myotonic disorders are painless. Disorders of peripheral nerves. Tetany results from hypocalcemia and alkalosis. Hypomagnesemia and hyperkalemia may cause carpopedal spasm. Severe tonic spasms are painful only during prolonged attacks. They may be provoked by hyperventilation or limb ischemia, causing a lowered depolarization threshold of motor nerve fibers. EMG reveals asynchronous group motor unit potentials, discharging at a rate of 5 to 15 per second, and separated by periods of electrical silence. Treatment is the correction of the underlying cause. Neuromyotonia manifests as muscle stiffness. In severe cases, stiffness is present at rest and impedes movement. Neuromyotonia occurs at any age and is usually sporadic. Motor neuron disease and muscle denervation of any cause may be associated with cramps. Central disorders. Stiff man syndrome is characterized by the adult onset of rigid, uncontrolled proximal and axial muscle contractions that are present only during wakefulness. Proximal muscle contractions are usually greater than distal contractions. The cramps are extremely painful and may be precipitated by movement, noise, or other sensory stimuli. They are blocked by curare, general anesthesia, and nerve block. The EMG shows continuous activity in agonist and antagonist muscles with normal motor unit morphology. Treatment is with diazepam, clonazepam, or other muscle relaxants. Stiff man syndrome appears to be an autoimmune disease resulting from antibodies directed at basal ganglia. Physiologic cramps. Painful muscle cramps may occur in normal individuals, usually at rest or after extreme exercise. EMG shows a high voltage, high frequency burst of motor unit potentials. And those are cramps. Have a great day.